Hi, my name is Dr. Sanaz Khorrami. I'm an internist based out of Newport Beach, California.
Hi, my name is Dr. Nikravan. I'm an endocrinologist and also an internist in Newport Beach, Southern California. Today is March 28, 2020.
So today we wanted to do this video a little differently than our previous ones. In the past, we talked about mostly facts about COVID, testing, treatment, and so on.
Science, data.
Exactly. And today we wanted to just talk a little bit about a healthcare worker's perspective on the COVID situation.
Right.
Both Dr. Nikravan and myself are part of organizations that have over 80,000 other physicians from all around the world and around the US. And we communicate with them on a regular basis, on a daily basis, and we hear their accounts of what they're seeing first line in the ERs, in the ICUs, and in other parts of the world. So today we got an email that was actually very moving and touching, and it just made us want to sit down and discuss this and shed some light on this to people out there who don't know what's going on for the healthcare workers.
I think we would title this video as the Public and Health Humanitarian Crisis. I believe this is the 9/11 of healthcare. If you recall how it was to go to the airport before 9/11 and how it is now to go to the airport, healthcare will change because of this. And therefore, I think that the way we perceive care, the way we give care will have to change.
Yes.
One of the emails they received that was just heartbreaking, as I was reading the email, I felt I was reading a script from a Hollywood movie, actually. It was just horrendous. I felt I was in a war zone. The description of the choices they had to make, the degree of illness, and how physicians were walking in corridors and actually crying over the decisions they've had to make.
So the biggest thing we keep hearing over and over again from hundreds to thousands of physicians across the US is that they're not provided adequate PPE, personal protective equipment such as N95 masks, shields, gloves, and so on by the hospital. But to take that one step further from what we're realizing from other physicians, not only are they not provided these things, but when they're able to secure them themselves and wear them to the hospital, administrators are actually coming over and taking them off their face or reprimanding them for wearing these things because they're saying it causes hysteria, it causes panic, and more importantly, they want to ration these things. So one example we got is a physician who was not allowed to wear their respirator. And this is a physician that was walking around seeing patients that were being tested for possible COVID, and they were told that they cannot wear it unless a patient is a known COVID positive. And right now with community transmission, there's so many cases that we're not aware of.
Absolutely, yes. It's rapidly increasing.
So I think not only is this dangerous to our healthcare workers, because if they get sick, they have to go home, you have nobody to care for you, but it's dangerous to other patients who actually don't have COVID, and the patient, the doctor becomes exposed and exposes everybody else. What was some of the other aspects of the communication we've received that has been that stands out in your mind?
I think that their lack of availability to protect themselves, protect the nurses, protect the first responders is the biggest hurdle that they're dealing with, and rationing care to a 65-year-old versus 75-year-old versus a 45-year-old patient. This is not a job of physician. This is not an ethical oath that we took. This is against everything we know.
So what Dr. Nikravan is referring to, already we're hearing in Italy and Spain, because the health system is so taxed, when patients come in and there isn't enough ventilators and beds, they will choose who do they get to intubate and give care to based on age or underlying conditions. And I'm sure people out there, a lot of them are thinking, oh, well, that's Italy, that's Spain. Those are not, the healthcare system's not as good as here. But you will be surprised that it's already starting to happen from what we're hearing in New York.
Let me shed some light for you. Let's go to the ventilators, artificial breathing that we have in this country. We have approximately 63,000 full functioning high-end ventilators. We have approximately 98,000 basic ventilators on top of that, and about 8,900 ventilators on standby for the government. That's about 170,000 ventilators, which is a good number. But here's the problem. Based on the CDC prediction, if we, at our best, will have 2.1 million patients who require acute care, that will require some kind of intervention, versus, at worst case scenario, over 20 million. Based on the data we've seen in China and Italy, because they're far ahead of us regarding what's happened here, 10 to 25% of these patients will need a ventilator. And that number translates at minimum to 250,000 ventilators for this country.
So that's 80,000 short than what we have.
So do you see now where the rationing is going to probably take into effect? This will happen to us.
This can happen to us, and this will happen to us unless we're able to what they call blunt the curve, which means we slow the spread of this virus to a degree where we don't get a surge of patients going into the hospital and taxing the healthcare system all at once. If it happens more gradually, then there will be enough vents for everybody. There'll be enough doctors to care for them and enough beds.
You know, at night, I stay awake just thinking about how we got into this mess to begin with. I'm going to give you a scenario, which is, I'm sure, happening as we speak right now. We have a patient with whatever name, male or female, age of 51, 52, who has an acute myocardial infarction, means he has a heart attack, or has an acute asthma attack that needs a 911 call. So the first responders, the police, fire department, paramedics come to the scene. And they rescue this patient, put him in the ambulance, take him to the ER. But what if 2 hours ago, the same responders went to a COVID house somewhere and responded to someone who's in distress? So they took this patient, they didn't have the protective gear, and they took this patient to the ER, exposed the doctor. Now they come to protect Uncle Joey, who's 51, who had a heart attack. Poor Uncle Joey, no health problems. He has now a heart attack. He goes in, he gets exposed to COVID. The ER doctor gets COVID. And then Uncle Joey is trying to recover from his heart attack in the hospital. He develops a fever. And they realize, whoa, Uncle Joey has now COVID. And if Uncle Joey develops cardiomyopathy from this COVID, he won't be resuscitated according to what's happening here. And most likely, they probably won't give him a ventilator because they think he's a support candidate. They're going to save it for someone who doesn't have it because they believe the people who require ventilation on COVID, based on the data seen, have an extremely grim response and benefit.
Especially when they have a comorbidity. So if you're seen as somebody who has a comorbidity, such as diabetes, heart disease, etc., so you fall lower on this list of how you're going to receive your care.
So this, as we talked about it earlier before, and you mentioned it earlier, that we're going to have our acute crisis that we need for asthma, diabetes, life goes on.
Life has to go on. There's still going to be a car accident. There's still going to be your kids falling off the,
breaking their legs, breaking their arms. Car accidents. You're going to need urgent care. You're going to need the emergency room. You're going to need the first line responders.
And we need proper, adequate PPE in order to keep patients safe that come in and keeping doctors safe that are working there, as well as nurses and all the personnel in there. And so that's very important. So if you guys have a platform, please fight for physicians to get adequate PPE. And then secondly, when we were discussing, allocation of care is really blunting this care will happen. Blunting the surge of this virus and blunting the curve will happen if we continue to socially isolate ourselves.
Correct. One reason, the rationale behind the rationing of the care and the ventilators goes back to some of the data the hospitals are looking at. They're looking at patients in-house in the ICU who actually code. It's the perfect setting because you've got a group of 10, 15 people that run into the room, they connect you, they disconnect you from the ventilator, they ambubag you, they CPR you, they give you all kinds of pressors to get your heart moving, chest compressions. It's like a whole scene if you've never seen it before. And those patients, 15.9% of those patients are able to successfully be discharged from the hospital. Okay. Now you throw a comorbid condition like bad heart disease, kidney disease, diabetes, lung disease, anything in comorbid condition. And if those patients code in the hospital, giving all the treatments available, they have a 3.9% chance of leaving the hospital as discharged. So they're using that data to say, you know what, we're not going to give this COVID patient the ventilation because if he doesn't respond in time, we're going to give it to someone else, which we see some of the logic behind it, but it's not how the healthcare is designed.
And it's not how we practice healthcare in the United States. I worked as a hospitalist for many years, and our goal was, as long as the patient was fighting for their life, we would fight with them till the very last second, and it didn't matter if they were 15 years old or if they were 110 years old.
But I'm afraid that's going to change. If we don't work together as a community, as a government, as a hospital leadership, that is going to change, and rationing care will just be the new norm until we get over this.
So today, one of the emails I received was from a fellow physician, was that her uncle was hospitalized due to COVID and had been on a ventilator for 7 days. And because his kidneys had started to do poorly, they had decided to pull him off the vent against the wishes of the family. Now, this is something that I've never seen that's been done in the hospital for all the years I worked there, that because you always go along with the wishes of the family, but because they needed the ventilator and they felt that this was a candidate that was not going to do well, they were going to withdraw care on this patient despite the family's wishes.
And I believe this patient was a physician too. As a COVID patient, he was a physician, he had COVID, he was giving community the service. And then, these patients can't have visitors. You can't go visit these people. So you're left alone to die.
So the most important thing is that what we get out of this is not to scare people, but is to be aware of the reality of it, that this is why social distancing is so important. This is why it's important to protect our elderly, because they do have a much rougher course if they get intubated. And I think as we start to maybe change the course and go back to work and go back to our community in a few weeks, I think we still need to take a lot more precautions for the senior citizen community, for patients who have underlying conditions. I think for them, we need to institute some form of greater degree of social distancing.
So it's a great point. Do you think we can and should go back to work in about 2 weeks, mid-April, based on the governments and the requirements?
I think it's different for every state, because each state is at a different point in this curve. We're a lot further ahead than some of the Midwest states are. But I think that realistically, we are going to have to go back at some point, if it's not 2 weeks, 3 weeks or so. And I think it will be a new normal for us.
Absolutely.
Like you were saying, as opposed to 9/11, the airports changed forever. There will be a new norm. There won't be the handshaking, the hugs, the kiss on the cheeks. People who work together need to be at least 6 feet apart. Offices need to be not as densely populated. Some of the other things we talked about is if the testing is available, that
Correct.
offices can even have testing there for somebody who has some symptoms, and they can check them if they can get results within 15 minutes to know if a worker has COVID and isolate them from other patients.
And some of the workloads can be decreased by doing telemedicine, which is a virtual visit via camera to the patient who don't physically have to be there.
Yeah, I think for anybody that can work from home, I would recommend that they continue to work from home for at least the next several months. But obviously, there's some situations where, restaurants need to, reopen so they can get the economy going, they can stay in business and so on. And maybe we don't have as many tables that are full at restaurants, we space them apart. So I think there's ways to go about getting back to our way of life, but I don't think it'll be the way it was. Correct. We knew it 2 months ago.
Correct. And I think that brings us to the next topic, is that I think we as a nation, we need to change the way we do things. I believe that far too long we have gone with drug recalls or manufacturers from China and some of the substrates they're using and the basic ingredients that come there because they want to keep the price of the drug so low for competition and profit margins too. How many recalls have we had in the past year or so? You would know that why your drugs are being constantly changed, because back order, recall drugs, etc. For us to be a superpower, we have to be able to produce all our goods that are necessary and vital for the functioning life in this country.
I think it's absolutely what you're saying is right. It's far too easy to, for us right now to go on Amazon, click a few buttons, and we have an item that's cheap and it's delivered to our home in 2 days. But I think there's a cost for that.
And I'm sure that every penny that we've saved, or dollars that we saved, or hundreds of dollars, or thousands of dollars that we saved over the last decade, we have lost in the last 2-3 weeks in the stock market, and the 401ks, and the retirement plans.
As Americans, we should be willing right now to pay a little bit more to buy American and to produce things here, such as we should be able to make our own vents here, we should be able to make our own PPE, we should be able to make our own medications here. And I think there is a trade-off because we pay our workers fairly, as some other countries do not.
Correct.
But I think it's okay to pay a little bit more, because the trade-off right now, we see that a lot of the things that we have shortages of, such as PPE, are made outside of this country, and it's very difficult to produce them rapidly currently.
Every single mask that we've been able to get our hands on are made in China. Every single one. I called the rep and I said, hey, listen, I don't want Chinese mask. I want American mask. Because we don't have an option. We don't even make them.
So, if this might actually end up being a good thing, and that we start making all these things ourselves, and because I really don't think this is the last time we're going to see such a virus that comes about and completely disrupts our way of life. But if we're well prepared for it, I think we can prevent a lot of the catastrophe that can come as a result of such a thing.
I want to send a shout out to Elon Musk for providing over 1,000 ventilators to the state of California and over 250,000 N95 masks. He's donated all of them to the hospitals across the state.
And also GM. GM is going to be working to make vents here, correct?
Great. It's going to take some time because they're going to go car manufacturer to ventilation parts and where are these parts coming from. And the most important thing, we want to be able to make sure we get this off the ground as soon as possible.
But I think, yeah, there's a lot of lessons to be learned from this. And part of them is changing our way of life in terms of, hand washing, social distancing to some degree, and also, being able to produce these things ourselves in our country. And really, trying to protect our first line responders. I think that's huge. I think that's going to be a huge part of this ordeal.
Great. Well, I hope you guys enjoyed this video. We have had a lot of points that we thought were dear to our heart. Our voice is through many, many thousands of physicians who express the same opinions. We hope that you share that with your loved ones and friends and family. And we hope that we can win this, and we will win this, because we have to work together with the government, with the community, with the state, with the hospitals, with the physicians. Everybody, the patients, have to come together. This is a fight against mankind, and we will win this.
Yes, and please, do whatever you can, whatever platform you have, use it for the first line responders. A lot of them are afraid to stand up because they get fired by hospital administration if they speak up and mention what's going on in the hospital in regards to the PPE situation. But we wanted to bring this information to you, and we hope that you'll use it in whatever way you can to help us.
Thank you very much.
Thank you.